we will hear House Bill 393. Representative Smith.
Members, House Bill 393, and it's been a while since I've been before you on these bills and these types of bills, but 393 authorizes the Department of Education to survey students regarding risk behavior. And the CDC puts out a voluntary survey every year that looks at behaviors of our youth in our school. It's voluntary and it's random selection of students, so it's not everybody that takes part in the survey. But since the survey has been going on, this assessment has allowed not only East Baton Rouge Parish but other school districts throughout the country to be able to look at asthma, to be able to look at drug abuse, tobacco use in our students, and to look at other areas where our students have taken risk, and policies have been looked at for districts across the country to initiate an institute so that students will be protected from these behaviors. And that's what the survey does. Louisiana is one of a few states that does not allow the opportunity for the sexual questions to be asked on the survey. And I would like to point out that in 2011, we were at a point where Mississippi was below us or above us in teen pregnancy as well as in the STDs and STIs. And in 2011, they decided to begin to use the risk assessments with the sexual questions included, and they now also offer comprehensive sex ed in their schools. Arkansas did the same thing in 2013 to be able to look at what the behaviors are and put those in place so that a comprehensive sex ed curriculum could be put together. So I have here someone with me who is going to talk to you about the assessment in general.
Thank you very much, Representative Smith. My name is Dr. Patty Kissinger. I'm a researcher, I'm a public health professional, and a nurse. I'm also the mother of 3 soon-to-be teenagers. So I speak on behalf of, and using 2 different hats. So as Representative Smith described, there are 6 different modules. The one module that we are not allowed to use in this state, though every state that is contiguous to us does use it. And there is no way for researchers or public health professionals to be able to get an assessment and to evaluate where we are. What we do know from the data, the STIs, our teenagers are getting sexually transmitted infections in high volume. We are number 1 for congenital syphilis, we're number 2 for gonorrhea, we're number 3 for syphilis, we're number 4 for chlamydia, and also number 4 for HIV. We're 6th of all states in the United States for teen pregnancy. So we can't stick our heads in the sand and not ask the question. We have to ask the question to be able to evaluate it so that we can then use these data to be able to get more prevention. If we don't get prevention interventions, we won't be able to get interventions or money or grant money to be able to do these things if we don't have an assessment. So I personally have had grants pass me by because I can't ask the question in school. And people in other parts of the country are scratching their head. They say, well, why can't you ask the question? If we don't ask the questions on sexual behavior, we want to know what the sexual behavior is going on so we can intervene before they get the STDs. Monitoring the sexually transmitted infection rates and the HIV rate is not enough. We need to know what they're doing so we can develop and devise and use evidence-based interventions to reduce this. I also want to say one thing. I know that one of the arguments is that if you ask students about sex, that you're going to encourage them to have sex. The issue that has not been corroborated in any data that is out there in the scientific community. In fact, the average teenager gets 143 messages about sex every single week. And this isn't even talking about what they get on their internet, their social media, Facebook, Instagram, and all the other things. So they're not that delicate. They're exposed to this stuff. Whether we like it or not, they are exposed to sexual messages. And the sexual messages that they're getting on TV are not, they're always portraying sex in a positive manner, but no ramifications of, no mention of teen pregnancy, no mention that you can get chlamydia if you have unprotected sex. So I think it's really that we're not serving our children unless we take the time that we allow researchers or public health professionals or teachers to ask the questions so that they can then intervene. Now, another thing about this survey is that it's anonymous, so nobody can go ahead and get that child's information. So it's as Representative Smith said, it's randomly selected, so they're not targeting any particular person. It's very statistically sound. They do surveying, they weight it. So it will just help for us to be able to get you can't understand the magnitude of the problem unless you measure it. So we must measure it in order to do that. I also, as a point of view researchers, to get research money, from the Youth Risk Behavior Survey, there were 18,000 publications, scientific publications that have come out of it. 6,000 of those have to do with sex. Guess how many came out of Louisiana? 0. So scientists are not wanting to come to the state because they can't do research if they can't get access to this information. At least behavioral researchers will not want to come. So I think in order to make us a cutting-edge state on top of our contiguous neighbors that are all allowing the sex questions to be collected, I think that we really need to move forward with this excellent bill.
Thank you, ma'am. Representative Ivey.
What happened to the role of parents to raise their children?
Are you asking me? Can I answer that question?
Anybody can answer, yes, ma'am.
Okay, well, I can say that as a parent, absolutely encourage parents to talk. So there have been data out there, 50% of parents feel very comfortable talking to their students about their children about sex. The other 50% do not. 17% of kids feel comfortable talking to their parents about sex. The rest of the 4 out of 5 don't.
So we're saying it's the role of the government to do the role of the parent.
That's the next bill. This bill is simply asking the questions. And I'm sure Representative Smith will talk about that, but this is simply, can we ask the question, did you engage in these behaviors so that we can understand interventions that we can do to help the students not to do the behavior. And we highly encourage parents. I think nobody who's promoting comprehensive sex education or nobody who's promoting the use of the Youth Risk Behavior Survey doesn't encourage and want very much for parents to talk to their children.
Right.
We all do.
I'm sure you're not trying to circumvent my point of the comment or question was that parents aren't doing their job apparently. To inform and educate their children.
I think it's very difficult.
Half of them are
I'm speaking as a parent now to young children, to soon-to-be teenagers. It's very tough. We're up against an enormous amount of pressure. My 8-year-old kids were singing the whistle song, which is about oral sex. And I said, whoa! And I consider myself an excellent parent. I'm very highly involved in my children's lives. They had no idea what they were singing. But it is a song on the popular radio about oral sex. So we're up against, if you look at the messages in TV, just take a look for a couple of minutes on TV, you'll see how they're bombarded, commercials. We're up against, so parents are trying their hardest, but they're having trouble.
And I'd like to also say that no parent wants their children to engage in early sex. However, there are children who are having babies at 10 and 11 years old. There are babies that are being born with low rates of low weight babies, and all of this stems from not necessarily mothers or fathers or guardians not talking to their children, but it happens that they may be inflicted upon by someone else, but they don't understand why that's happening to them. Along with that, parents tell their kids about sex and not engaging in it, but how many times do you let your kids go out with a group of kids and you never know what really happens when they go out? You don't really know. You can talk to them all day, but I can tell you that there are some kids that will take risk. They will risk what their parents tell them and go beyond that. And that's why we're having the issues, what I call a pandemic in Louisiana, because what we're not doing is being able to determine what those risks are that they're taking, along with being able to have a remedy for it. So parents can talk to their kids, but kids still sometimes end up pregnant.
A couple more things. You mentioned the purpose of this is to lead to intervention. the purpose of the research, and I heard a lot about money and grants and money and grants. Well, look, it doesn't take any researcher to know that our culture has become very sexual oriented. Okay, we have kids watching, rated R movies with a lot of inappropriate material. Parents, okay, parents allow this. Parents allow what their children watch on TV. If you give a child the age of 10 a remote control to satellite TV with all the channels, and you don't monitor that, guess what? They're going to get anything and everything they want. I have 4 kids. One of them's a teenager. One of them's a preteen. As a daughter, and so I'm in there with all the other parents, okay, who are dealing with the pressures from peers, being in school, the environments there where I may have a sheltered home at my house, but obviously when they go to school and other environments, those protections aren't there. So I don't see what this bill does to fix anything, because it's common sense, okay? What's wrong? Okay, you already mentioned that you have the STDs, you have the birth rates. Well, why is that? Well, because they're engaging in sex.
But we can't get NIH money, we can't get CDC money, we can't get NIH money.
I know.
And we can't get any of the funding to do the interventions unless we can evaluate. Now, in all of the scientists, you have to have evidence-based
on behalf of their children. Do all parents want you to intervene? I don't want.
They're all opt out.
This is a randomly selected.
How about opt-in?
It is not. It's anonymous. It's not something that somebody's going to send to your child and say to your child, you have to fill this out. They're randomly selected, and it's anonymous. Your child's name is not on it. No one's name is on it. It's simply looking at the behaviors. We would not be addressing teen alcohol. We would not be addressing teen drugs. We would not be addressing teen tobacco use had it not been for this youth risk assessment survey, because that's where we got the information from on what our students were doing in order for us to come and do the interventions. That's why you hear of so many interventions now.
But your interventions are only saying what the parents are saying.
Not all parents are not saying that.
Okay, but
Some of
the
the
point
parents are
is,
not.
you just mentioned,
What about parents? What about kids who are not
Who don't
in
have parents.
homes with parents to take care of them? What about students who get their information from their peers? I mean, these are not just low-income kids. These are kids that a lot of kids. And I went to Catholic school, and the things that they told us about sex at Catholic school when I was in school, you wouldn't even want to touch a boy because you figured you'd get pregnant if you touched them. So my point is that we've evolved over time, and we've evolved now to the point where, as you say, there is more sexual information being provided. But our kids, we need to know basically what are the risks your children are taking out there, because you are not with them 24 hours a day. You don't know what your children are doing 24 hours a day, only when you see them. And this simply gives an opportunity for information to be gathered to be able to provide interventions for whether
it's not linked to any specific child.
No child.
So no child's name is used. It's simply a surveillance system so that we can benchmark ourselves with other states and figure out where are the deficits and where do we need intervention to help the children.
Well, last comment. Personally, I would not want my daughter to receive some form about asking her, and of course she doesn't have to fill it out. I wouldn't want her to read the questions. Okay, about, do you engage in this act and all these, whatever the form may be. Because you know what, my daughter is sheltered, okay? And I wouldn't want her to have to even see that form, to be honest with you.
But do you know that your daughter receives sex education in Catholic school?
She's not in a Catholic school.
Oh, well, okay, I thought she was in Catholic.
No,
But
it's
Catholic
private
school,
school, but not Catholic.
Catholic schools do provide sex education.
Let me, when Representative Schroeder had his data privacy, I mean, does this, we're okay? I mean,
It's random
we
and it's-
spent a long time on that, and they had a lot of things that I was surprised that people have access to. And so I'm just asking, how do we protect and ensure that when that bill comes forth that
It's anonymous. You don't have any names on it. So it's just something like sometimes we get surveys to do on education and other things that you don't necessarily have to put your name on it, but it's anonymous.
Okay,
so nobody is identified on it.
and DOE is going to send this survey out?
It comes from CMS and it goes to the schools from the Center for Disease. not CMS.
CBC.
CBC.
Department
I
of
got
Education.
Medicaid on my mind too.
So the School Board Association of School Principals, everybody are on board to administer this?
Well, they already do it for the other things other than the
They're
sexual
already asking
question.
children about, have you injected
Right.
heroin? Have you used an assault weapon? Have you text messaged while you drive? So they're already asking them about, they've identified 6 areas of the highest issues with children, the highest rates of morbidity and mortality among children.
And the only reason why these questions are not on it now is because we have not passed a bill to enable it to be on there. So these other ones have bills that have been passed to ask these questions?
They opted out of the sexual questions only. Only the sexual questions are not asked in Louisiana.
And who opted out?
I presume DOE or.
Would you mind if she'd come to the table to answer your questions? Is that okay, Representative Smith?
Yes.
Okay.
Thank you, Mr. Chairman. Erin Bendeley with the Department of Education. There is a full survey, but because of the law that's currently on the books in Louisiana, which prohibits the surveying of this particular content, my understanding is that there are 9 questions of the survey that are not given to Louisiana students. So basically, those 9 questions associated with this content are removed from the survey just in Louisiana.
Okay, and so the questions that you're going to ask are only 9?
Right.
Okay, all right. Okay, are there any other questions? Okay, in support, would not like to speak is Terry Young from Louisiana. I don't know. Tanya Nyman, Representative Self is in support, would not like to speak. Sophia Stevenson is in support, would not like to speak. Katie Renya is in support, would not like to speak. Attorney Broshanan, I hope that's pronounced, it's either a B or an R, is in support, would not like to speak. Steve Monahan in support, would not like to speak. Ryan Carter is in support, would not like to speak. Veronica Brooks, Louisiana Association of Public Charter Schools, in support, would not like to speak. Debbie Moe, LAE, in support, would not like to speak. Denise Dupuy is in support, would not like to speak. Dr. Michael Walker-Jones, in support, would not like to speak. Kerry Wooten is in support, would not like to speak. Carmen Wisner, in support, would not like to speak. In support, would like to speak is Autumn. Thank you.
Thank you.
It's an honor to be able to.
Yes, ma'am. Hang on one second. How you pronounce it again?
It's Autumn Fawn. Autumn like the season,
Yeah,
fawn
I
like
got
the baby
that part.
deer.
Okay.
Gandolfi.
Okay, hang on one second. Also, Cardell Washington is in support, would like to speak.
How are you? Good to see you again.
He waves. Thank you, sir. And Belinda Davis is in support. Okay. Yes, ma'am. Please introduce yourself for the record. Welcome,
Hi.
and thank you for being here.
My name is Autumn Fawn Gandolfi. I'm an ordained medicine person from the tribe of Homa in New Orleans, Louisiana. It's an honor to be able to testify on this very, very logical bill. To answer your question as to why the sexual portion of the CDC's Youth Risk Behavioral Survey has not been allowed in Louisiana, it's because in 1992, when Mike Foster received Title V funding from Bill Clinton's Personal Responsibility Work Opportunity Act to create an abstinence-only until marriage sex education program, which has fallen under heavy scrutiny. And Ivy, I completely understand your concern with the government basically interfering with the health and education and well-being of our children, because since 1992, we've had a program that the 2007 congressional study has deemed one of the most ineffective and actually harmful sex education courses that are currently running in our country. Essentially what we've found, and what numerous studies have shown in state-by-state comparisons and in national comparisons, is that there's more to know about sex than just know. And as a medicine person, who's someone who counsels people in terms of relationships, and that includes the sexual aspects of young women's relationships, as I do mentoring services as well. I find that the key to ensuring that our young adults have the foundation that they need emotionally, spiritually, and psychologically to be able to navigate the highly sexualized world that we live in now. I know you don't want your daughter to be asked whether or not she's had sex, or whether or not she went to a doctor after she had sex, or did she use contraception. But, sir, since I was 8 years old, every time I checked out of the grocery store, I had a magazine telling me 50 ways to lose weight, and excuse the expression, but 30 ways to give a blowjob. The amount of sexualization that our young girls are facing requires a level of sex education that goes past this petty argument that I feel like we're about to enter into, and it just really disheartens me. Because, see, at the table for this whole conversation, you've got two sides, and it's not really a fair representation of our real moral values as human beings. Let's please avoid the temptation to make this sort of the birth control condoms people who just like want your kids to have a bunch of sex versus, you know, the just say no, chastity, it's parental responsibility. This debate is done. We've got to fight for healthy relationship education for our children. We can't legislate that our kids be told not just to not have sex. And the reason that we're not able to ask our kids these questions is because when this program was implemented in 1992, a great way to make sure that your failing public program that was basically, I think it was about 12 fundamentalist far-right Christian organizations wrote our sex education textbook. They were contracted by the state of Louisiana, and if you want to ensure that those contracts continue, I would sure as bet that you really don't want to survey whether or not young adults are having sex. Because what you're going to find is what you're going to find in every other national study, is that young adults that come out of abstinence-only programs, which we've been running since 1992 in our public school system, are, A, just as likely to have sex as the average teenager, but they are less likely to use contraception. I went to an all-girls Catholic high school, and I received Mike Foster's program on abstinence, and we were provided false and misleading information, as told by my gym teacher, who refused to carry the course to fruition because she felt guilty for giving us this sort of information. We were shamed. We were told that we were going to be used up like a piece of gum if we had sex outside of marriage. We were basically told that any of our desires, our attractions, were essentially just going to get us into a world of trouble. Rather than talking about developing a healthy relationship with your body, yourself, determining your own moral compass, sir, no one's getting married at 16, 15, and 17 years old anymore. Most of us are waiting until we're about 25 to our 30s, even early 40s. This whole notion that the state body can continue to support a legislation that insists that the only sex education we give young adults can be abstinence until marriage. Abstinence is absolutely a part of the equation, but we have to ask these
questions. Please begin to wrap it up. I appreciate it.
Well, let me
Thank
tell you why we have to ask these kids these questions, because in addition to denying Medicaid expansion money from the federal government, our state has also denied federal money from the Teen Pregnancy Prevention Initiative, which requires that any program to be implemented in our public school system be an evidence-based program. So you got to prove that the program works, which is not the current standard that our current sex ed law requires. So we have to know, just like we have to know if our kids are texting and driving. We can't wait till we get our STI reports from the Louisiana Public Health Institute and Department of Health and Hospitals to realize that something's going on here. There's this terrible, terrible, terrible issue, and it's a massive lack of education.
Okay, thank you, ma'am. I appreciate it.
You'll see me again.
Yes, ma'am. Thank you. Yes, ma'am.
Hi, my name is Belinda Davis, and I have a PhD in political science with an emphasis in public policy. I've done evaluation work for the states of Louisiana, Michigan, as well as Florida. And I'd just like to point out that government programs fail to properly address societal problems most often when they are not data-driven solutions to the problem. And so collecting survey data about the activities of teenagers will allow our state to address a problem based on a true understanding of the problem. You cannot have a solution that adequately addresses a problem without information. And so I'm just encouraging you to use a data-driven approach. That's it.
It's collecting data on a survey that already exists. Because if you want to solve the problem of teen pregnancy and sexually transmitted diseases among our teenagers, you cannot do that without adequate data. Thank you.
Yes, ma'am. Thank you. Representative Bishop, you had a question. Do you need to bring somebody back to?
No question. I'll just gonna move favorable.
Okay. Representative Ivy, do you?
Bring the young lady back, who's a counselor.
Okay. Autumn, I'm not going to go any further. Thank you, ma'am, for coming back. Yes, sir.
Do you have any children?
No, sir. When I was 19 years old, I found myself in an unintended pregnancy, and I elected to have an abortion procedure. After that, I went on to be a counselor at a women's clinic, speaking to women the day of their procedures, making sure everyone was clear and firm in their decision. I did help a single mother raise 2 sons, and have offered various child care services to single parents that are in my family. So I don't have any children that are biologically my own. I'm going to choose to adopt in about 5 years.
Okay. Well,
But
I just quick question: if you had any or not, but you are obviously helping raise some. As a parent, and I speak for my constituents. Okay, as a parent, we have parental rights. Okay,
Certainly.
and you know what? Your survey is going to lead to intervention. Okay, and you know what? I choose to teach my children, okay, about sex education the way I want to. And I choose that the state or government or any group who's done research not intervene, okay? Because guess what? My kids aren't being raised like a lot of the kids who maybe find themselves in these situations.
Sir, can I just tell you, I mean, we can get into this like weird
Well,
code.
no, but some of the comments you made was like, all the old, hokey Christian,
No.
guess what?
I mean, sir, I was raised in an evangelical fundamentalist home. I did True Love Waits, and True Love waited till I was about 17 years old, and that's when reality hit. So I'm with you.
Right, but
And
the point
I grew
is,
up in the culture, and I understand. You don't want the government to intervene. I feel the same way. The government is intervening on young adults having the full capacity to get all the information that they see fit, because these abstinence programs use fear and misinformation. They disvalue contraception. They basically shame people who do want to have sex. The fact is that when your children go off to college and they begin to have adult relationships, there's a set of knowledge that, believe me, you're going to want that. You're going to want your kids to know it.
I'll teach them.
And you'll teach them, and that's fantastic. But at the same time, we have to quit allowing legislation to block young adults from having the access to determine their own moral compass.
Right. It's the parents'
Abstinence
job
is a part of
to-
the equation.
It's the parents' job to help establish the moral compass for their child. And when my children leave my house, okay, the foundation that I've laid, okay, will let them determine what they want to do. But when they're the young adult in my house, okay,
Listen,
the rule
this is
is,
about
guess what? Hold on. The rule is, it's my house. These are my rules, and you'll follow them. And then I'll lay the foundation. When they become an adult, they can choose to do whatever they want. So thank you very much.
Because specifically your parental role and your certain moral set, you're saying that you are going to legislate your personal morality on the general population when we're dealing with a situation where 1/4 of our young adults have HIV. There's a professor at Tulane University by the name of Mark Allen Derry who just completed a study that's going to be going to a review board, which would be very pertinent to this community, that basically says that our abstinence only until marriage sex education policy, LA 17281, is essentially the reason that we have a 80% representation of young black adults that are new HIV victims. Do you know why? Because our school system is continually segregated. And do you know who's under the implementation of our sex ed law? The public school system. So who has been receiving misinformation about sex, misinformation about contraception? Who's been receiving the majority amount of shame and stigmatization?
Okay, ma'am.
Unfortunately, our poor black community. And if that's a conversation you want to get into about personal responsibility and blaming parents, we know where the dog whistle politics is.
Okay, thank you, ma'am. Yes, ma'am. Representative Bishop, your light still on, but you've just moved to report favorable. Okay.
I put in a card to speak against
No,
this.
I hadn't got there yet.
Okay, well, I just didn't want you to move.
No, I'm not moving anywhere, apparently, for a while. Okay. In opposition and would like to speak is Sandy McDade. Sandy, okay. In opposition would not like to speak is Hillary Violet. I hope I pronounced that correct. Jim Crumlings, Acadiana Patriots, is excuse me. I'm sorry. Jim Crumling, Acadiana Patriots, is in opposition, would not like to speak. Nathan James, the governor's office, in opposition, would not like to speak. And Gene Mills is in opposition, would not like to speak. Yes, ma'am. The floor is
I'm in
yours.
the uncomfortable position of wanting to speak.
Yes, ma'am. That's
And I
quite all right.
apologize
That's
for
what we're here
taking your
for.
time.
Please feel free. Yes, ma'am.
My name is Sandy McDade. I was around back in the 90s when, actually it was prior to the 90s, when we decided we didn't want our children participating in the sex surveys that we're discussing today. There are a lot of other issues regarding another bill that's coming up, I assume, today, so I'm going to try to narrow on to just simply the surveys. The reason surveys were rejected many years ago is because parents, legislators found them very, very offensive to themselves and to their children. They were leading surveys. They weren't just surveys that said, do you have sex? They were surveys that said, do you have sex with the opposite sex or with someone of your gender? They're very, very leading. There is zero evidence, zero, that these sex surveys have any effect whatsoever on our children's behavior in a positive manner. Absolutely no evidence. There is a lot of evidence that says that they could have a negative effect. Children go through a time in their lives when the concept of sex is basically on hold. There is no need for us to begin questioning them in the schools. I raised 6 children. I fostered a good many children. Some of them were teens. One was a young lady who was pregnant. It wasn't a problem of knowledge. Trust me, they had more knowledge than I had about the issue of sex. It is not a problem of knowledge. It's a problem of parental training and parental guidance. The federal government, the state government, and the local government cannot change that with a sex survey. The surveys are not necessary. The surveys have no evidence that they ultimately do any good whatsoever. And I'll wait till the next bill to go into other things. But I respectfully request that you defer this bill. Thank you.
Yes, ma'am. Thank you very much. You have a question? Okay. Representative Smith.
Thank you. You say that the survey doesn't do anything.
There's no
So,
evidence that they have a positive effect.
So
no.
let me ask you this question. When the survey started in 1992, we began to ask our children about tobacco use, about drug abuse. You say that information that we gleaned from those surveys did nothing to help our state to move forward on teenage smoking as well as teenage interventions regarding drugs.
I would venture to say it probably did not.
Why not?
And I would say that because we knew our young people were smoking.
Not
We
in
didn't have to
92.
ask them on a survey.
Not in 1992.
Well,
as
you
much.
go and you sit in a group of young people and have to literally cough your way out of it. You knew young people were smoking.
But not at the
It had
age.
nothing. The answers had nothing to do with asking them questions. We knew the answers to those questions before we ever asked them.
But the age groups are different, not necessarily the older groups. The age groups are different in asking those questions. We were able to intervene earlier on young people's
What did you
drug
do to
abuse.
intervene?
You have eye care programs throughout the state. You have other drug programs. You have DARE programs in our schools. They're going into elementary schools talking about drugs and what have you. There are a number of interventions that are dealing with tobacco use as well as with drug abuse. And that survey still asks the question, do you inject heroin? So the point is that they're still asking these questions because those situations are still occurring, but not as much as numbers as they used to. Our younger children are not involved. You ask them today, do they want to smoke? Most of them don't, because of the interventions that have occurred, of the things that have happened as far as cigarettes. So I would wager to say that we have done some good, not only in the state but in the country, because this is not just taken by Louisiana. This is taken across the country in looking at these behaviors that children are getting into. And it takes also other states getting involved and collaborating together on how we intervene in these things. So I would wager to say that the survey has done some good.
Well, I would respectfully request that we not use our children as guinea pigs for sex surveys.
Okay. Representative Ivy for a question.
Yes.
Quick question. To your knowledge, in the DARE programs or any other, the tobacco, all this, are they trying to teach our children how to safely use these things, or to not do
No,
these things?
they actually try to teach them not to use
Okay, so
them.
don't use.
And, no,
okay,
they
so
don't. They don't
vape
go
instead
through
of smoking actual
yeah.
tobacco.
They don't go
Okay.
through the
Okay.
try this and see if you like it.
All right, but in
stage.
sex ed, is it, currently we tell them, hey, look, you shouldn't because, and, I haven't been through the program personally, but I think that's based on testimony, what I'm hearing. So, but I think in the intervention and things that they're wanting to do is to teach our children how to safely practice these habits.
That's
Is that correct? Okay, thank you.
Thank
Okay.
you.
There are no further questions. I saw Representative Smith ease into the back. I'm sure she'll be back here in just a second. We lack a quorum right now also. Yeah. Nope. Sorry, we caught you at a bad time, Representative Smith. Okay, we have no further questions. You may close on your bill.
Members, I know that this is a difficult subject for some, and it is something that individuals do within their own purview of their homes, but that is not available to the hundreds of thousands of children that we have in the state of Louisiana, that everybody has the same ability to do the same thing within their own household. And to neglect the opportunity for us to be able to intervene in those particular issues really does concern me. And it is unconscionable that we still have the same high rates of STIs, STDs, chlamydia, gonorrhea, syphilis amongst 13 to 19-year-old children, as well as high teen pregnancy rates. So I encourage you to at least let us be able to look at how we can provide opportunities for programs that will assist us in preventing these things happening with our children. And I
Okay.
ask for your favorable movement.
Yes, ma'am. Thank
Well,
you.
it's already been moved. Thank you.
Okay,
Louis.
Representative Bishop moves to report House Bill 393 favorable. Is there any objection? And there is objection by Representative Ivy, so I will ask the Secretary to please call the roll.
Representative Bishop votes yes. Representative Broadwater? Yes. Representative Burns? No. Representative Carmody? Yes. Representative Champagne? No. Representative Edwards? Representative Henry? Representative Hollis? No. Representative Ivy? No. Representative Jefferson? Representative Jefferson votes yes. Representative Landry? No. Representative Price? Representative Price votes yes. Representative Reynolds? Representative Richard? Representative Shadwin? Representative Smith?
Yes.
Yes. Representative Thompson? No. Representative Williams? Yes. Passes 7-6.
Okay, that bill will be reported favorable by a vote of 7-6.